Healthcare. Okay, how health insurance works. Healthy people buy health insurance knowing that eventually they're going to need it. So it's like gambling. You spend your money hoping that you're going to get a payout because you're going to need it eventually because you're going to get sick. So you're paying into this big pot of money thinking that one day when you need it, the insurance company will be able to hand it to you and you can pay to go to the doctor. So when somebody in your health insurance pot or group gets sick, then the sick person only pays a fraction of the cost and you have covered some of it yourself, thinking that one day it's going to work out for you. Now, healthcare in this country costs a lot of money. There are a lot of things that contribute to the increased cost of healthcare, like new technology, which is always good, new procedures and drug research. All of that's good stuff because it helps us become more healthy and battle major diseases. Also, malpractice lawsuits have increased healthcare costs in our country because when you think that the doctor has screwed up, then you sue. Then that doctor, every doctor, has to have a lot of insurance to cover malpractice suits because they're worried that people are going to sue them if there is an accident. And then when they have to pay for increased insurance for malpractice lawsuits, they pass that cost on to you. In this in the whole healthcare debate, you'll hear a lot about socialized medicine. Socialized medicine is the idea that there will be medical care for all people. It would be paid for by taxes and it would be regulated by the government. So you could just walk into a doctor's office for free, you could get health coverage, you could get treated, and then you would walk out and you wouldn't have to pay a thing. But you would have been paying higher taxes the whole entire time. Okay. Medicare is an aspect of our social or health care policy. Medicare was passed as part of President Johnson's Great Society. It was passed in 1965 and it covers the health care cost of people who are 65 and over. As you can see, this chart covering the older people is costing us more and more every year, partly because there are more people getting old and because healthcare is increasing in cost. Medicare Part D covers the prescription drugs that 65 plus people need. Now, everybody thinks, well, LBJ and his liberal Great Society program increased the expenditures of the federal government by passing Medicare, but Medicare Part D was proposed and passed by George Bush Jr., so W. Okay. Medicaid is a means-tested program. Medicaid is to get coverage for people who fall below the poverty line. Also in this, there's a thing called S-CHIP. S-CHIP is Medicaid to young people whose families may not be able to afford paying for the health care and the prevention of diseases for their children, so you would be covered under S-CHIP as a minor. Your parents might not have health insurance, but at least you do. So S-CHIP is like the kids' Medicaid. So the way that I remember it is like Medicare for the old, aid for the poor. So Medicaid for the poor. Now, a lot of people have tried to address the fact that there are 46 million people without insurance. And mainly the people without insurance are young people from the ages of 18 to 32. These are people who don't anticipate getting sick or don't think that they need insurance because they may feel a little invincible. They don't anticipate anything bad happening to them. But these are the healthy people that need to pay in the system to cover the sick people that do need insurance payouts. So since about the 1990s, you've seen politicians talking about the need to reform healthcare in this country. Hillary Clinton attempted, when she was First Lady, to come up with a reform and to encourage a socialized type program or a universal health care plan where everybody in the United States would be covered with insurance regardless. That attempt failed. What we ended up with was the Affordable Health Care Act, what we know as Obamacare. What Obamacare calls for is people with pre-existing medical conditions, like maybe born with a particular disease like diabetes, or people who had previously had cancer. Um, People who have pre-existing conditions would be able to get health care and would not be able to be denied health insurance. Now, insurance companies would want to deny these people because, again, insurance is a gamble. You pay into the system thinking one day you will need a payout. But people with pre-existing conditions will probably need a payout a lot sooner than a healthy person. So insurance companies didn't want to cover them because they knew that they were going to cost the health insurance companies money. Now, with Obamacare, regardless of any pre-existing conditions, you have to be covered with insurance. People 18 to 26 could stay on their parents' insurance instead of being kicked off at 18. So even those huge group of people who didn't have full-time jobs, didn't have employer-provided health insurance, would be able to maintain healthy lifestyles and get preventative checkups and things like that while still staying under their parents' insurance plans. These two things about Obamacare have been pretty popular. People haven't argued against this. But the only thing is, in order to have the pre-existing coverage, what you have to have is a large pool of people who are healthy and are not going to need insurance, because they are going to pay into the system without asking the money back. So that's where the individual mandate comes in. Obamacare requires every person in the United States to have health care coverage, regardless of whether their employer can provide it to them or not. If your employer cannot provide it for you, then you're going to have to go shop for insurance yourself. That's where the website or those healthcare exchanges come into play. The website is supposed to be a marketplace to shop around for insurance. It's like the health insurance version of Amazon. But we know that the website was not that great. It was clunky, confusing to navigate, okay, and it had gotten bad press. But by March 31st, everybody in the United States, if you do not have health insurance purchased by either your through the federal healthcare exchanges or your state-run healthcare exchange, you are going to have to pay a non-insured fee. The non-insured fee is a fine or a tax on people who have not gotten insurance. The non-insured fee was supposed to be $96 for this year, so if you didn't get health insurance, you'd have to pay an extra $96 in taxes, but that wasn't the case. The case is really you pay 10% of your income if you don't get insurance, and that's 10% of your income per household. Now you're saying, what if I can't get insurance? Well, if you fall below the poverty line or you fall into a means test, then those who cannot afford insurance will be eligible to purchase subsidized or government plans that are cheaper. But again, you have to be poor to get that. Not everybody will be eligible. Again, one of the reasons we have this Obamacare reform is because we've had unequal access to health care. When the cost of healthcare is increasing because of expensive drugs, um, expensive technology, new procedures, and malpractice lawsuits, you see a lot of people are priced out of having health insurance. Health insurance is very expensive. Our country, we have privatized insurance. It's not nationalized. It's provided by private corporations, not the national government. So not everybody in our country is guaranteed health insurance coverage from their employers. They or even from the government. You have to go take care of it yourself. Most people have employer provided insurance. 60% of people get their insurance from their jobs. Unemployed people have to pay for health care themselves. And if you cannot afford to pay for it, then you will get fined through the Affordable Health Care Act. Okay, there is a racial divide and an income divide. A greater percentage of minorities and low-income families don't have insurance. Okay, again, if you qualify through means test, then you can get S-chip for your kids or Medicaid for yourselves. Okay, but that's really hard to do. Part-time employees, I don't care how many part-time jobs you have, part-time employees are not eligible for benefits. Many small businesses cannot afford to pay for their employees' health care. And if a small business can't afford to pay for their employees' health care, those too will get fined. This is where it starts to get really unpopular, or the Affordable Health Care Act gets really unpopular. Most people who do have insurance have an HMO. These are an organization of healthcare providers that your insurance contracts to serve you. So my insurance, Anthem Blue Cross Blue Shield, has contracted a couple of doctors to provide me health care. I don't necessarily like them, but I'm stuck going to them because I don't have the choice of who I'd like to go see. My insurance chooses that for me. Um, so again, let's talk about who should pay for healthcare. Um, the government, the government already pays for about 50% of cost and a national health insurance plan, which is Medicare and Medicaid. Um, but again, we really see that most of your health insurance, or most people's health insurance, is also paid for by an insurance company, which pays about 30% of the cost. Employers also pay into health insurance, and we as individuals pay about 20% of healthcare cost. Um, and if you're in class, we'll go over, I'll be able to discuss that and answer any of your questions. It is a complicated idea, Obamacare, um, since I got a second to recap again what it calls for is that people with pre-existing conditions must be covered by the insurance company, but in order to do that, everybody has to pay into the system. If you don't pay into the system and get insurance, then you're going to have to pay a fee. This is really difficult for small business owners or people who have multiple part-time jobs but not full-time employment to be able to get health insurance. And then you're going to get fined if you don't provide your employees or you cannot pay for insurance yourself. The cost of insurance is just increasing. We do have privatized medicine in this country, and most people do get insurance through their employer. Now, Obamacare, or the Affordable Health Care Act, was deemed constitutional by the Supreme Court. The uninsured fee was not considered a force or a mandate to make you buy something just because you're alive. It's a tax, and we all pay taxes, so that's why the Supreme Court upheld it.